Hi there, Anthony Llewellyn here again. I just wanted to do an even quicker video to give you a few quick details that are specific in relation to those students doing the Hunter Clinical School rotation in psychiatry. Firstly, I'd like to say that we've taken on the feedback that we've been given over the last few years in terms of the variety in rotational experiences that students, particularly in the Hunter, get when they're doing psychiatry. It is a difficult issue to make sure that everyone gets to experience all the types of conditions. We try as much as we can, but we also need to make sure that we have enough placements for you. It's also difficult because psychiatry is such a broad thing, and when you do a general psychiatry term, say on an acute adult inpatient, you actually miss quite a whole lot of things as well. We also have to be cognizant that in 2020, we're going to have a double year between where we have Year 4 students and Year 5 students doing psychiatry, so it's going to be even more difficult. But with all that in mind, what we've done in compiling the rotations for this year is try to give everybody a blend of 3 or 4 weeks in a more general psychiatry experience, as well as 2 or 3 weeks in some of the more subspecialty areas. We're also organised it so that students are generally working in pairs in those rotations, so that you've got a buddy throughout your experience, which will help you with the presentations that we want you to give on the Friday morning around certain topics. So the other key change that we've made in the program is we've moved away from faculty presenting on topics to you presenting to your colleagues and us, the faculty, on topics. So you will be required to present some cases with your pair on a Friday morning. It'll be facilitated by a member of the faculty, and your colleagues will be there to hear the cases as well. So we'd encourage you to go through those topic lists and identify cases so you're prepared for that activity. What we'd like you to do is, in your pairs, is one pair present the case and the other pair research around the case. So, for example, if your colleague has presented a case of a patient who is having trouble getting the right sort of treatment for a depression, maybe the medication's not working for them, maybe there are other problems, you might then research and do a small teaching session with your colleagues on the different types of antidepressant classes and what might work in that particular situation. Or you might choose to research psychotherapies that might be relevant in this particular condition. So we're using the clinical material to help with our learning, expanding around topical areas. So that'll be every Friday morning. Friday afternoon is free study time. We do not expect that you are on the ward. We do expect that you are studying. Your wards will be notified about that. Again, that's part of a move to doing things differently in the lead up to the new MD, where in the new MD, the students will have Friday afternoon free so they can meet with their research groups. So the key things are, we've changed the clinical rotation so that you can get a better experience of the different types of patients that present with mental health problems. You will be working generally in pairs, and we expect that you'll be presenting on topics in pairs. I would also point out that if you feel like you've missed something, there are the opportunities to do after hours, and you should think about those in terms of whether that might give you the opportunity to see some other different types of psychiatry that you're missing out in your particular rotations. So that's it. That's the video for the Hunter Clinical School.